Semaglutide actually has been found to be more effective than all prior weight loss medications, which is semaglutide. Semaglutide was first approved around 2017 by the FDA under the trade name Ozempic, and it was first approved for type 2 diabetics. And so what they kind of found as people were taking this medication, that a side effect was weight loss. So then that caused people to look into the medication a bit more, and then it went under the trade name Wegovy a bit later in 2021 for the indication was for weight loss at that time. So semaglutide is a GLP-1 agonist. So basically it just kind of helps insulin work better in your body. Semaglutide actually has been found to be more effective than all prior weight loss medications, which is very exciting. But that means that it doesn't come with certain risk, and it's also for a certain population, people who are basically obese or overweight and suffer from different medical problems. So how does semaglutide work? Semaglutide, again, is a GLP-1 agonist. So basically, it just helps insulin work better in your body. It helps your body be more sensitive to insulin and helps fight really insulin resistance. It slows your stomach emptying, so it's going to make you feel full longer. And it also kind of acts in your brain in a way to help you feel like or think you're more full. And then that way, basically, you're cutting down your portion sizes, and also helps to regulate your blood sugar, so you're not getting these large blood sugar spikes, and it helps your hunger level really decrease. So perhaps maybe you can choose a healthy protein with a salad instead of being so hungry that you're going to go for something instantly feeling like a pizza or a hamburger or something processed and high in fat. In some studies, semaglutide was shown to reduce the amount of plaques in blood vessels. So this is also reducing the effects of stroke and a cardiovascular event. So that's definitely a positive thing for the drug. And we often wonder, okay, so who is semaglutide for? Who can take this for weight loss? So really it's for people who are obese. So that would mean that you have a BMI of 30 or greater, or a BMI or overweight with a BMI of 27 or greater with an additional health problem such as high blood pressure, high cholesterol or dyslipidemia, cardiovascular disease, or maybe some form of prediabetes or insulin resistance. So that's really who the drug is targeted for. We know kind of it's gotten a lot of bad press when it's been used by people who maybe were just trying to get off 5 to 10 vanity pounds or already at a healthy weight. That's not really who this medication is for. This medication is really for those people who are really chronically obese or overweight and have those health problems. So for you to use the medication safely, again, you come in, be assessed by a medical provider to see if you qualify. So who cannot take semaglutide? There are certain people with certain types of pancreatic and thyroid cancer. If you've had a history of them, or a family member has a history of these cancers, you cannot take them. Diabetic retinopathy, they're not for pregnant women. If you've had any kind of prior reaction to a semaglutide, you don't want to take semaglutide again. Also, you want to watch if you've had any recent history of depression or current suicidal thoughts. Semaglutide is a medication that you want to avoid. So if you're somebody who is overweight and struggle with and have high blood pressure or other medical problems, or you are obese or have a BMI of 30 or over, should come in and be assessed. Maybe this medication is right for you, especially if you have any type of prediabetes or insulin resistance. This medication can work nicely for you. And that leads us to is I often get asked, what kind of diet or exercise will I be doing on this medication? So this medication, like all weight loss or fat loss medications, work in conjunction with a healthy diet and exercise program. So again, this is not just at least to eat whatever. When you come in, we're going to combine it with a healthy diet and exercise. This just helps give your body that extra edge to control the appetite and make those healthy decisions so you can start losing body fat and start getting healthier.